Hello everyone, today I'm going to be talking about how nursing assistants take care of lung cancer patients and the elderly. But before we talk about that, let's discuss what's a nursing assistant, their training and certification. A nursing assistant is a healthcare provider that provides basic care to residents in nursing homes, hospitals, home care, hospice, and much more. They usually assist patients with activities of daily living and perform tasks that were assigned by nurses. In order to become a nursing assistant, you need to take the CNA program, which consists of a clinical course and CNA itself for at least 75 hours. But before you take the program, you need the following prerequisites. Now, in order to be certified, you need to pass a written or oral exam. This also depends on where you live. Now, let's talk about lung cancer and how it relates to the elderly population. Lung cancer is the abnormal growth of cells in one lung or both. It relates to the elderly population because of their aging process. Their structure, functions, and their immune response changes with age. The most common cause of lung cancer in the geriatric population are due to the normal aging process by DNA mutations, which are errors in the DNA strand. However, environmental risk factors are also another cause of lung cancer, such as cigarette smoke and the release of radon gas. Immunotherapy such as Opdivo and Keytruda can help increase survival rates in elderly patients, especially if they have metastatic lung cancer. Lobectomy, the removal of the lobes, and chemotherapy can help too, but there are complications of all these. Some complications for immunotherapy are skin reactions, pain, swelling, soreness, and dyspnea, which is difficulty of breathing. This can also attack healthy tissue because it's a stronger immune system. Some complications for lobectomy are dyspnea, chest pain, nerve pain, numbness, and muscle soreness. These are just temporary side effects. Lastly, some complications for chemotherapy are hair loss, pain, mouth sores, trouble breathing, weakened immune system, nausea, constipation, diarrhea, bruising, bleeding, rashes, and neuropathy, which are damaged nerves outside of the brain and spiral cord. You're probably asking, why are the elderly allowed to take surgery or chemotherapy? Isn't surgery going to harm them more since their bodies are so delicate? Why take chemotherapy since there are so many side effects? Although people think it's risky for an elderly patient to do surgery, they are more likely to do surgery at their early stage of cancer. Now for chemotherapy, it really depends on your health overall and not the age of the patient. So if they act like an elderly, then the majority won't take chemotherapy. Now let's talk about how nursing assistants take care of the elderly patients with lung cancer. In order to take care of lung cancer patients, nursing assistants need to prevent infection, so they use standard precautions. If the elderly has done chemotherapy, nursing assistants need to add more precautions such as cleaning their room thoroughly and wearing personal protective equipment. Skincare for elderly patients are making patients to move to their preferred sides so nursing assistants can apply pillows to prevent pressured ulcers. Nursing assistants also use pillows to make the patient sit upright if they have dyspnea. Oral care for elderly patients are usually brushing their teeth normally. However, nursing assistants rinse mouths mildly for lung cancer patients. For nutrition, lung cancer patients usually have meals that are small but frequent. If the patient has trouble breathing or they can be easily choked, then cut their food into small pieces. Some activities for the elderly who have lung cancer are breathing exercises, so inhaling and exhaling. Walking or any aerobic exercise, but walking is most recommended for the elderly. And lastly, stretching. As you can see below, there are several stretches you can do. Now, who do they work with? They work with oncologists, pulmonologists, and nurses. Oncologists and pulmonologists usually work together to give the patient their plan. The nurse records all the information, so as the nursing assistant, and both the nurse and nursing assistant work together to help support their patients.